And welcome, everybody. For those who don't know me, I am Kelly Merricks. I'm the Vice President of Philanthropy with Sheltering Arms Foundation, and we are thrilled that you all could join us today to hear Dr. Cindy Ralston. Just a couple of housekeeping items. Lisa Cheney and Tricia Ambler are our hosts of the meeting, and they have the wonderful ability to mute everyone, as they will do so to reduce feedback noise. So they will do so. So when we get to question and answer at the end, you may need to turn turn off your mute button. In the interim, if you do have questions, we'll be doing question and answer at the end, but there is a chat feature, which is at the bottom bar of your screen, that you can always click on that and type a question as we go. And Cindy will hopefully be able to answer that at the end of the session. But again, we really appreciate your joining us. This is the second of our Giving Power workshops. We have done these in the past in person and have obviously moved to remote this time, but it's a wonderful way to join us for about 30 minutes of your afternoon. So I am going to, before I introduce Cindy, I want to say thank you to all of you all for supporting Sheltering Arms Foundation, and more importantly, supporting our patients at Sheltering Arms Institute and Sheltering Arms Physical Rehabilitation Centers. Your gifts make such a difference in what we are able to do. And this presentation by Dr. Ralston will really demonstrate some of the unique aspects of Sheltering Arms Institute and things that we may not be able to do without your support. So we appreciate that very much. Just by way of a quick introduction, Dr. Cindy Ralston is our speaker today, and she is a graduate of Marietta College with a BA in psychology. She has a master's in clinical psychology from Ohio University and her PhD in clinical psychology, also from Ohio University. She joined the VCU Physical Medicine and Rehab Department faculty in 2011 as an assistant professor, and in July of last year was promoted to associate professor. And her expertise is in rehabilitation psychology. In addition to being a lecturer in many programs, she serves on the editorial board and as an ad hoc reviewer for the Journal of Clinical Psychology in Medical Settings. She has published 13 book chapters and co-authored 6 poster presentations at national and international meetings. Dr. Ralston provided clinical services as part of the interdisciplinary rehab team at VCU Health for many years, and in 2012 was named Director of Inpatient Rehabilitation Psychology. She also joined as one of the 6 transitional leaders for the Sheltering Arms Institute joint venture with VCU Health and co-led the creation of our mission, vision, and values. And then she helped to lead 16 of the 68 operational plans to get us to the point that we are today, and in moving towards the organization's vision of reinventing rehabilitation for a life beyond limits. She currently serves as the Director of Psychosocial Services and Interprofessional Science at Sheltering Arms Institute, where she works with rehab psychology, care management, and chaplain spiritual care, as well as supporting the Richmond Hospital Education Program presence, serving the educational needs of school-aged children at SAI. And there is so much more I can say, but Cindy, what I can really tell you is a wonderful, wonderful team member who lives and breathes the values of Sheltering Arms Institute every day. And we are so honored to work with her and to have her represent us in this way. And I know you all are going to enjoy hearing from her. And as I said, we will have a question and answer in the end. And with that, I will turn it over to Cindy.
Perfect, Kelly, that was so sweet. Thank you very much. And sometimes I sit down. It's all really good. I love doing this work. For the past 20 years as a clinical psychologist, I've been practicing in a rehab setting. So I'm very, very excited today to share with you what it means to be a rehab psychologist at Sheltering Arms Institute and bring science in action to our patients and our teams every day as we look to reinvent rehabilitation for life beyond limits. I have a quick disclaimer on the next slide, which basically says I'm not making any extra money off of any of this, but I am involved in several projects, so I wanted to make you aware of those. Also, gratitude to my dear colleague, Dr. Daniel Kleiss, who did a presentation earlier this spring that served as the springboard for some of my slides, which you'll see marked with an asterisk. He gave me permission to share, and I'm grateful to him for it. So I am so excited to bring rehab psychology to you in a very personal, hopefully experiential way. My objectives for this afternoon is that at the end of our time, you'll be able to really express how that specialty practice of rehab psychology is different than the way that we often think about psychology, and how it's uniquely suited to the needs of our folks who are in the acute rehab setting, like we have here at Chiltern Arms Institute. I'm also excited to walk you through some real life examples of how evidence-based psychological interventions can help our patients recover in areas of emotional well-being, cognitive abilities, and health-related habits. So let's go ahead and jump in. A couple of things, if you would, as we're getting started, grab a piece of paper, grab something to write with. We're going to use that a little later on. Also, if you've not experienced polling in Zoom, Trisha's going to help me here in just a little bit, and I'll ask you some questions that you can then respond to by using your keyboard. So I'm excited to bring some of those interactive aspects to our talk today to make it really engaging and meaningful for you. So let's start at the very top. What's psychology? Psychology is the science of human behavior and mental processes. Oftentimes when we're talking about what psychology is, we think about clinical psychology. We think about Frasier. We think about sitting in a darkened room, lying on a couch, talking about our childhood, having people say things like, and how does that make you feel? All of those are true and accurate aspects of clinical psychology, but psychology is more than that. We study the science of human behavior and emotional processes, including cognition and emotions, things that are not observable, in scientific ways to bring information and tools to help better mankind, to better humanity, to help people ameliorate their distress and improve human functioning. And rehab psychology is its own distinct flavor of psychology. And I wanted to highlight some of those differences. I was trained as a clinical psychologist. So when I was in school, I was really learning about things like depression, anxiety, autism, all those primary mental health diagnoses. When you practice and live the life of a rehab psychologist, you may have time to work with folks on those issues, but your focus really is on the adjustment that's right there in front of you, right there in the room with individuals and their family members who are managing illness or injury after things like new spinal cord injury, traumatic brain injury, stroke, amputation, traumatic car crashes, all sorts of things. Even life after COVID comes with adjustments, and your rehab psychologists are uniquely trained to help think about that process, the phases of it, and how to support you through every aspect of it. In clinical psychology, one of the things I learned to do were very standardized assessments. We can measure things like intellectual quotients, emotional quotients. We can measure your personality and all of its aspects and nuances in very standardized ways. When we get into the rehab psychology world, it takes a little more creativity. It takes a little more flexibility. So we certainly have all those standard assessment methodologies at our disposal. We also have some non-standardized approaches to really capture the evolving patterns of strengths and difficulties that folks might be experiencing in the course of their recovery. Your thinking and memory right after a stroke or traumatic brain injury is not going to look like your thinking and memory 2 weeks from now. Because good news, you're healing, you're working with your therapist, you're continuing to evolve. So we want to be able to take shelf time limited snapshots of what those things are looking like so that you can understand where you are, your team can understand, and help you move forward efficiently and effectively. As a psychologist, I often practiced on my own or as part of a broader team group of practitioners, of psychiatrists, other counselors and therapists. But when I live as a rehab psychologist, I'm part of the team. I'm right there with your physical therapist, occupational therapist, speech therapist, chaplain. Hi, Dr. Glory Flowers. We're part of a team. We work closely with our physicians and nursing friends as well. And I love that work, bringing the team dynamic and being able to help the patient, not only when I'm working with them, but to give those tools to the whole team for them to work with is phenomenal. And it really expands the influence of our positive practice. We also, in addition to focusing on emotional well-being, which is the main focus of clinical psychology, We also look at cognitive and health-related behaviors, which oftentimes don't have time or space to be addressed in the terms of a clinical psychology practice. So Beatrice Wright, for example, was one of our founding scientist clinicians, and I wanted to highlight her. She passed away just a few years ago at the age of 100, and she was one of the founding clinicians who helped define rehab psychology as its own unique specialty. So if you'd like to learn more, there's a couple of links there. But I wanted to highlight the differences by just telling you a story of a gentleman that I met early in my career. I was working in a rehab facility where I had met an individual who had a spinal cord injury following a really traumatic car crash. This gentleman I met, and he told me this story of taking his 2 adult children in the car. They drove to the airport where they were going to pick up his wife. She had been away for a conference for a really long time. They didn't spend much time apart. So when they finally got to be together again, they talked one of the kids into driving, and they sat in the back seat so they could snuggle. It was the sweetest thing I had heard. And then things went terribly wrong. As they were driving home, there was an unavoidable and unexpected failure with one of the mechanical parts of the car. There was an awful crash. The daughter was terribly injured. My patient was terribly injured, and his wife died. And so I sat there and I thought, you know, as a clinician, as a clinical psychologist, one of the tools that we have is cognitive behavior therapy, where we look at a situation and we examine our perspective. We think about how we might be distorting the cognitions, the way that we're thinking and talking to ourselves about the situation. And really, if we appraised it, is it so bad? If we looked at it a different way, could we see the positive? Could we help ourselves to feel better and do better by thinking differently about this situation? How in the world was I going to say that to this man? There was no way. There was no way. So rehab psychology, and oftentimes we move away from these cognitive strategies because it's not a distorted reality that you're seeing. It is your reality. It is really hard. And I'm going to tell you more about this gentleman as we continue to move forward. But I wanted to highlight his story as a way that rehab psychology is unique and different than your traditional clinical psychology practice. And I'll tell you more as we go. So rehab psychology is different. If you'll click over to the next phase, I wanted to talk just a little bit about some of the things that we focus on. As promised, I want to walk you through some experiences that talk about the emotional things that we can help address while folks are in inpatient rehab. So imagine my gentleman. He's lying there in bed, new spinal cord injury. He's going to have some feelings about this. One of the predominant experiences that our folks have at an emotional level is post-traumatic anxiety. So when we think about anxiety, especially after trauma, it's characterized by 5 different kinds of emotional experiences. One is you have this re-experiencing of symptoms. I've often talked to folks who they close their eyes and it's like it's happening all over again. I can see it, I can smell it. It's a very vivid thing. It's not the same as remembering, it's re-experiencing, and it's very distressing. Folks can also experience avoidance symptoms. So for example, my gentleman who'd been in a really bad car crash, he has a really good reason to not want to get into a car again anytime soon. But here's the thing, if you want to go home, you're going to have to be in a car. So if we're going to work through that avoidance, we need to think about the emotions and help to manage those. Oftentimes folks will experience arousal and reactivity. What that means is basically you've got a smoke detector on the inside of you that is going off every time you're making toast. It doesn't take anything to set off the bells and whistles. Think about it. This gentleman was literally snuggling in the arms of his beloved when suddenly the world was turned upside down. Your system doesn't take that lightly. It's going to look around your environment 24 hours a day for any signs or signals that something bad is going to happen again. So feelings of stress, difficulty sleeping, somebody drops a tray out in the hallway and you feel like you're going to come out of your skin. That arousal and reactivity is a real hallmark of post-traumatic anxiety. Folks may also have cognitive and mood symptoms. They may feel down or depressed. They may feel detached from other people. So all of these emotional hallmarks are part of what's normal after such an abnormal experience. If we can look at the next slide, one of the most powerful things we can do is help to normalize these experiences. For most of us, hopefully, we don't have these kind of life-altering experiences often, or maybe not at all in our lives. So when you find yourself scanning for danger, looking at all of those physical symptoms, your attention focuses and you can't think about anything else but keeping safe or getting out or staying away, you engage in those escape or avoidance behaviors. And that seems completely normal. It makes sense and it brings you relief. But here's the downside. If you keep using escape, if you keep using avoidance to get to that point, say you're trying to avoid the pain and anxiety that goes with putting weight through something that's been broken. If you continue to avoid and get away from those experiences, it's going to become harder and harder. The anxiety continues to build, and the only way to find that relief is to get away from the activity or avoid it altogether. That's not what we want for folks. So what we do is we provide, if you'll click to the next part of the slide, we help reset that anxiety cycle. So what we do is we help people have tools to manage the anxiety. We know it's normal. Your body is going to ramp up when you start thinking about getting in the car again. Of course it is. That makes total sense. And you still want to get in the car again. So let's work this through. You're going to have a short-term slight increase in anxiety, and then slowly you're going to notice as you use those coping skills, your physical symptoms, your attention comes back down. You start to believe in your ability to manage those, and you can continue to progress your behavior, to manage that as emotions effectively and successfully. Let's take a real world example. Work for me for just a second. Let's imagine, if you will, that you're about to do something kind of stressful. Not crazy stressful, not like life-altering stressful, but just your normal everyday, kind of ramping up there a little bit stressful. Finishing your taxes, having a difficult conversation, public speaking, you know, whatever it is. For my husband, it would be moving that snake out from under the front porch. Whatever it is that you know is going to ramp your stress up a little bit. Take a minute, use your imagination, put yourself in that position. It's getting ready to happen. It's not going to be fun. You know you got to do it. You can't get away from it. What are you noticing? What are your thoughts? What are your feelings? What are you noticing in your body as you really make that real for yourself? Think about what you're going to see. Think about how your body is going to feel. What are you going to hear? Just give that a moment. Bear with me. Okay. First polling question. Trisha, can you pull up our stress rating scale real quick? Yes. So right now, from a 1, which is totally chill, to 5, how's your stress level right now? Pick A, B, C, D, or E. We're going to move through this pretty quickly. So Trisha, whenever you're ready. Great. Thank you. How are you guys feeling? Ooh, you did a good job. Nicely imagined. Okay, we're going to help bring it down. Nobody get too panicked, because here we go. So imagine again. Here's the intervention part. This is what your rehab psychologist can do for you. So imagine you're getting ready to have that conversation. You're getting ready to go under the porch. You're ready to file your taxes. And it goes okay. You take a deep breath. You sit up, you stand up, and you're tall. Your shoulders are back. You expected it to go kind of rough, but you know what? It's going okay. You're noticing that this task, this conversation, this thing that you needed to do, it's going pretty well. You were really prepared for it. And you did really well. In fact, the other people who are like noticing are like, you know, that was pretty stressful, but you handled it so nicely. You seemed confident, you seemed calm, and you did a great job. Thank you. They're actually thanking you for taking care of this. Take a deep breath. You did this. How are you feeling now? Bring up those poll questions again. You were able to take on that situation. You managed the stress of it. What's that like? How are you feeling now? You may still notice a little excitement, a little energy, invigoration, but hopefully it'll be qualitatively a little different. Trisha, what have you got for us? Oh my goodness, you guys are fantastic. So this is exactly the kind of thing that we offer our folks. So not only do we have to do this in your imaginations, which, let's pause, you did brilliantly. Thank you. That always doesn't go as well as that. You all are rocking it. But we give people these tools. We help them imagine and then gradually work through that situation. So for this gentleman, just even being past our fake car in the gym was really stressful. So we gradually got a little closer. We practiced some coping strategies, which we knew worked for him. He was able to feel that success, not fall into that escape, not fall into that avoidance, and build comfort and confidence in being able to move forward. How empowering is that? How does that flow over into your other emotional landscape bits that are feeling overwhelmed and in totally uncharted territory? These are the kind of things that psychology does in rehab. This is how we bring science into action for each and every patient. And it's not just limited to emotions. That's one of the things I promised to tell you a little bit about. Let's think about cognition. So for my gentleman, he didn't have a stroke. He didn't have a traumatic brain injury, but it's recently been stroke month. I wanted to highlight what happens to thinking and memory after stroke. There can be memory loss. For my gentleman, he was struggling, just feeling, foggy and fuzzy and wasn't remembering things like he normally did. He said he felt different in his own skin. And so it was hard to notice things that he was trying to remember that normally would have just come like that to him. And a lot of times he could remember things he heard, but it was hard for him to remember things he had seen. So somebody was teaching him to set up his wheelchair or make a safe transfer using the transfer board. And those things were not sticking as strongly as they normally would. So let's launch into another example. Let's talk about how rehab psychology, and to be fair, we're not unique in this. This is where you're going to need your paper and pencil, but I want to give a shout out to my other colleagues. Our nurses do a beautiful job of this. Our occupational and physical therapists, and in particular, our speech therapy colleagues do a fantastic job working on cognition. So this is not unique to psychology, but again, remember, you've got a whole team working with the whole you. And so this is something that psychology can help contribute to your plan of care and empower you to do to help with your recovery. So if your thinking and memory is feeling a little fuzzy, one of the things we might do is just check in and see how you are doing, remembering different types of things. Sometimes it's things that we hear, sometimes it's things that we see, just like this. So here's what's going to happen. When I ask Trisha to, she's going to pull that rectangle down and you'll see a grid of some things that I want you to remember. I'm going to give you about 15 seconds to remember as many of those things that you can on the page. Then we're going to put the rectangle back up and you have to remember as many of them as you can. Jot them down if you'd like. Trisha will help us notice how many things you're remembering. We'll check it with the grid and then we'll go on to the next slide. Make sense? Okay. Trisha's going to pull down the rectangle. You ready? Go. Remember as many of these as you can. Okay, put it back up. All right, take a few seconds. Jot down. How many of those objects did you remember? Go ahead and pull it down, Trisha. Oh, can you pull down the, can you hide the poll for just 1 second and pull it down so people can check and see how many they remembered? Sorry. Let me show you the answer. Check yourself. How many did you remember? There were 8 things there. How many did you remember? Sorry, Trisha. Now you probably have to type it again. Sorry. There we go. How many did you remember? This late in the Monday afternoon, not too shabby, y'all. What do we get? Oh, you are good. So about half of them. Excellent. That is not bad. Let's say we go for better. So one of the things that we can do as psychologists is take what we know about cognitive science. We study learning and memory in graduate school, and we learn strategies to help people use their memory more effectively and improve it. So 2 things I'm going to ask you to do. I'm going to show you another grid, just like we did before, but I want you to use 2 strategies at the same time. And I think you're totally going to be able to do this. One, see those pairs? I want you to pair the images. I want to pair the words. So each one of those words is going to be right next to another word. Take those 2 objects and put them together. And I want you to create an image. I want you to use visualization. So there are 2 objects right side by side, and I want you to think about how they might go together. And here's one of the tricks. Make it crazy. So if it's eggs and bread, I want you to see a chicken wearing a cowboy hat on top of a baguette. Okay, I want you to make it crazy, but put 2 things together, make a crazy image and see it in your mind's eye. You'll have a fantastic imagination. We proved that earlier. So I want you to use it right here. So we're going to go through the same thing. Everybody got it? Let's move to the next slide, Tricia. Thank you. So how many objects can you remember? We're going to pull that down, give you about 20 seconds. You ready? Go. And cover them up. Beautiful. All right, use your paper, jot them down real quick. Give you a couple of seconds. Awesome. Pull the rectangle down. Yes, and check it for me, guys. How'd you do? How many objects did you remember? What do you got? Did it help? Let's see. 3 to 4, very good. There were more this time. That was really tricky, but I'm seeing more folks had gotten up there in the 5 to 6. That's a great strategy for remembering things. So if you have that proverbial grocery list that has, heaven help us, stretched beyond the 3 items that we know we can remember, try those strategies. It can really help. For our gentleman, we did some sequencing so that he was able to connect this step to that step to that step, and some mnemonics that really helped him. So rehab psychology, in addition to dealing with emotional stuff, can help you with your cognitive recovery. And last but not least, on the next slide, I want to take just a minute to appreciate all these things that we're talking about. They live in your skin. Whether we're talking about feeling sad or frustrated or elated, noticing that you're not thinking or remembering like you used to, struggling to move your body in ways that were easy before, struggling with pain or sleep. All of these things are happening in our own skin. And I know that seems obvious, but there's some joy and some power that comes with that, because you have choices. There are things that you can do with your own magnificent body that will make such a difference. For my gentleman that I was telling you about, one of the things that he was struggling about, and it was totally foreign for him, was nausea. Some of the medications he was taking made him feel really queasy. He always had a very healthy appetite, but also had a really strong and healthy diet. So this was really challenging for him. So I wanted to give him a tool that he could use his body to help him to develop a habit and get back to some of those healthy eating things that he had before and not be so constrained by feeling queasy. So if you'll move to the next slide, we're very quickly going to move through a breathing exercise. Psychologists are very fond of breathing. We have breathing exercises for all sorts of things, and we would always tailor them to you. So because he didn't have any breathing problems, because he hadn't been intubated, he didn't have asthma, I gave him a breathing technique. It's called the 4-7-8 breath. We're going to breathe in for a quick 4, hover. You don't have to hold your breath, but just float there for 7, and then breathe out. Push down as deep into your dark diaphragm as you can to really push all that carbon dioxide out. If you have any medical conditions that make this not for you, sit this one out and just be still and notice your breath. That is perfectly fine. But for the rest of us, we're going to breathe in, 2, 3, 4, float, 2, 3, 4, 5, 6, 7, push out, 2, 3, 4, 5, 6, 7, 8. Go ahead. Do it one more time. Breathe in, 2, 3, 4, float, 2, 3, 4, 5, 6, 7. Good. Out. 2, 3, 4, 5, 6, 7, 8. Now just a nice soft breath. Pull out that polling question. I'm hoping that you weren't so stressed to begin with. You were at a 1 before. What's your stress level now? Maybe I should have put some negative numbers on here. Rate your stress level for me. How did having that nice, soft breath, really cleaning out the carbon dioxide, affect your, what did it do with your stress level? Go ahead and mark that. And when you're ready, Trisha, let's pull up the results. Beautiful. Oh, y'all are amazing. This time on a Monday afternoon, full score. Nicely done. So that's just another great example of what psychologists in a rehab setting bring to the table. We take science, we take our understanding of physiology, of cognitive science, of emotions and self-regulation, of arousal and parasympathetic arousal, and we hand it to our patients. And let me tell you one other thing. I hope that this is obvious, but it bears clarification. If you could pop over to the next slide, Trisha. I can have all of the knowledge, I can have all of the tools in the world, and if I, for some reason, don't feel heard, don't feel seen, don't feel understood or cared for, all of that's for naught. Let's look who I'm talking about. This is my rehab psychology team. All of these are brilliant scientists. They know their stuff inside and out. The medical, scientific, psychological research knowledge that you see on this page is comparable to none. It is a phenomenal team. And they can sit and make space to be with people no matter what they're going through. So for my gentleman that I was telling you about, for him, it was such a blessing for me to be able to sit and just make time and space to hear everything that was going on for him, the emotional, the physical, the spiritual, the cognitive, the physical. All of those challenges needed a voice, needed some time. And just by sitting and listening, for him to be able to say things out loud that he didn't want to put onto the lives and ears and minds of his loved ones was so, so powerful for him. And it was astonishing to watch him heal. And it was astonishing to see his strength. And I was so grateful to hear his appreciation of me, and knowing that what I was offering him was based on a real and genuine relationship in that time, that what I was offering him was not just, how does that make you feel, blah, blah, blah. It was what he needed in that time. And every single one on my team is just a master at that. And I am so grateful. And what I know that they continue to see, and I am thrilled to share with you, is this message of hope. Because after trauma, there's not just anxiety, there's not just stress, there's post-traumatic growth and resilience. So as we as an organization and as a community are looking to reinvent life beyond limits, each individual is reinventing themselves in ways and growing in ways that are unexpected and gorgeous. So I am so excited to have been able to spend a little bit of time with you this afternoon, giving you some one-on-one experiences of what it means to bring science-based interventions to our patients, to these humans. Rehab psychology is here to empower each and every one to use these explanations, this understanding, these tools and skills to allow every human with which we interact to move in the direction of their goals. I'm really grateful for your time this afternoon. I think we've got maybe 30 seconds for questions, but let's go ahead and circle back and see what folks would like to talk about. Thank you for your attention. Oh, did I lose you? No, there you are. Okay. Thank you for your attention. Oh, Barbie, I didn't know you were here. Hi, Allie. What kind of questions do folks have? I would love to speak to anything that you're curious about.
Cindy, how often should people do the breathing techniques for stress relief? Is there a dosage that's recommended?
Yeah, it depends. It really does. One of the things that I help people understand is the best time to practice that is not when you're feeling particularly crunchy. So for our folks, a lot of times we'll ask them to find a trigger throughout the day. So like right before every meal and right before going to bed, for example, is a good trigger. If you're trying to build a new habit, you can attach it to something that you're already doing on a regular basis. That's why we do things like leave a new pill bottle next to our toothbrush. For these folks, I don't want them to try these relaxation or breathing techniques when they're already stressed, when they're really in pain. One of the glorious side effects of having a really good mastery of relaxation and breathing techniques is that sometimes you'll fall asleep. So don't practice it when you're driving. That's not a good idea. But if you're having difficulty falling asleep anyway, it's a glorious thing to practice right at bedtime to allow yourself to have some nice relaxation. So depending on what folks are noticing, we want them to develop this skill so that they feel comfortable and confident in using that. And then again, I don't operate in a silo. I work in a fantastic transdisciplinary team where they all know these breathing techniques as well. And the patient can cue them. Hey, I've been practicing my 4-7-8 breath with Cindy as we're getting ready to get up in the parallel bars. And I know it's going to hurt. Can I take just a second? And the therapist will do that with them. But I want them to have practiced it when they're not feeling so stressed so that they can feel like they have good mastery of that skill. Great question. Thanks, Brian.
Any other questions? Cindy, it doesn't appear that there are any other questions. I just want to say that was just a terrific presentation. We're really, really grateful to you and your team of colleagues in the psychosocial world here at Sheltering Arms Institute. And I hope everybody on the call comes away from this call with a greater appreciation for both the resources that are so visible when you walk through this place, looking at the technology in the gym, but those resources that are less visible. And so, of course, our first presentation in this series a couple of weeks ago was from Chaplain Flowers. That presentation is recorded and available to you. Cindy's presentation will also be recorded and available to you. And just want to make a plug for Allie Holmes. Fascinating field of speech pathology. Cindy gave you a little bit of a teaser about speech pathology, but it too is, and there's Allie right there. So it is really, really fascinating. She's got some really cool camera technology. So we're really excited about that on June the 22nd. And finally, I just want to thank my team of colleagues who have worked really hard to pull this off. Lisa's here in our control room, and Trisha is at, I don't know, we're all over the place, but everybody's just done a wonderful job pulling this off. We would love to get more ideas from the audience around topics of interest. But finally, my thanks to each of you for participating and dialing in and spending about 40 minutes with us today. So unless I've left anything out, we will conclude here and look forward to seeing you again on June the 22nd to hear our own Allie Holmes speak on speech therapy, more than just talk.
Sounds great. Thanks.
Goodbye all. Thanks for being with us.
Thank you all. Have a wonderful rest of your afternoon.
Bye-bye.
Thank you,
Bye.
everyone.